So again, apologize for the technical difficulties. If we get disconnected again or lose audio, I will be sending you a recording of this webinar in its entirety by tomorrow, right? Okay, so if you do have any questions that pop up during the presentation, you can put it in the chat box. I'll try to review it at the end and answer any one-on-one questions you may have. We're already 15 minutes behind schedule, so I'm going to run through this pretty quickly. You can always watch the recording if there was something you missed or wanted to review. All right. So thank you all for joining. I'm Dr. Ernesto Medina, founder of For Healing Health and Wellness Center in Round Rock, Texas. This presentation broke a record with how many people registered for this presentation. We had about 33 people registered for it, which tells me there's a huge need for more information on this topic. And so really quick, I entitled this presentation, A Holistic Approach to Mental Health, an alternative and also synergistic approach to the conventional medical paradigm of managing mood disorders like anxiety and depression. And so quick disclaimer here. This is just information. It's not intended to treat or diagnose any condition. Please be sure to consult advice of your healthcare provider for any medical concerns, and so on and so forth. All right. This right here, this is one of the sources where I get a lot of my training and information. The Karazian Institute is a accredited educational platform through the National University of Health Sciences for continuing education for licensed healthcare providers. Because I'm licensed, I have to do continuing education each year. This is one of my go-to places because the education here is top tier. A lot of research, a lot of clinical applications around functional medicine. So I did see a couple doctors registered for this webinar, so that's a great resource if you want to check that out further. So let's talk about the standard of care around psychiatric conditions. And again, we're focusing really on anxiety, clinical depression, and debilitating anxiety. And what ends up happening is most of the time, a person will talk to their primary care doctor. They'll mention either depression or anxiety. That doctor will prescribe antidepressants and or anti-anxiety meds like Xanax, other benzodiazepines. Maybe they'll refer to a cognitive behavioral therapist for talk therapy. And maybe you'll get a referral to psychiatry for further management of medications, especially if the first round of meds don't do the job, don't work. And so this is a pretty traditional approach to psychiatry. The problem with this is, and what I'm challenging is the idea that not all mood disorders like anxiety and depression are purely psychological. They may be, but there are a number of physiological conditions that have a symptom and side effect of mood disorder, meaning a physiological condition can cause depression and anxiety as a secondary symptom. Just medicating as if it were a purely psychological condition does nothing to address the underlying physiological issue, right? And so I'm going to elaborate on that a little further. If we talk about other potential physiological causes of mood disorders, we have quite a few. We have hypothyroidism and hyperthyroidism, right? Now, our next webinar is going to focus on thyroid conditions, specifically hypothyroidism. And one of the most common symptoms of hypothyroidism is depression, irritability, and anxiety. And so this is a perfect example where we work here with a lot of thyroid conditions and hypothyroidism. We start improving their thyroid, and now their anxiety, depression gets better, right? So their underlying physiological cause of their depression, anxiety was their thyroid condition in the first place. So would it be appropriate to simply medicate this individual with antidepressants and not properly address the thyroid? Maybe short-term, an argument could be made short-term for the mood condition, but it would be completely useless long-term to medicate an individual with antidepressants. right? Hashimoto's is another one. Hashimoto's is an autoimmune condition that causes hypothyroidism, reactive hypoglycemia, meaning chronic blood sugar crashes, chronically low blood sugar, dysglycemia, meaning unstable blood sugar, creeping towards insulin resistance and prediabetes, is known to cause anxiety and depression. And we have another webinar in the future coming up on dysglycemia specifically, and insulin resistance and prediabetes. There's a lot to know about that. IBS, irritable bowel syndrome, and small intestinal bacterial overgrowth. Okay. Now, it's very common for an individual suffering from IBS to develop anxiety around their chronic urgency to use the bathroom. It's very common for an IBS individual to start to develop fear around going to places and not knowing if they're going to have an explosive diarrhea attack and need to find a restroom right away, right? So that's another example of anxiety being a secondary symptom of a different underlying physiological condition being SIBO or IBS, right? Dysautonomia is another condition, causes irregular heart rate, sometimes tachycardia, irregular blood pressure, lightheadedness, dizziness. Dysautonomia is a term wasn't understood or wasn't known for a long time, but since COVID, dysautonomia is becoming a lot more well known because it's a very common long haulers for COVID symptom. And then, of course, PMDD, known as premenstrual dysphoric disorder, right? For a long time, just referred to as PMS, but now a diagnosable condition of PMDD, hormone shifts in women, depending on where they are in their cycle, can cause massive mood shifts and mood changes to anywhere from severe depression and anxiety to happiness all the time, right? And a couple of years ago, I had a patient who came in who would be severely depressed, bedridden for a week, crying the week leading up to her period, right? And so again, is the proper approach that is medicating them with antidepressants, or is it investigating into what is the hormonal imbalance contributing to those symptoms and addressing that? And that's exactly what we did for her. We measured her hormone levels. We worked on improving balance between estrogen and progesterone in her early phase of her cycle and the late phase of her cycle. And it made a world of difference for her. Right? And we'll have a future webinar also on the female hormone cycle and healthy hormones for women. Right? Now, I not only speak to you as a clinician, but also as a patient. And this was probably one of my main driving motivating factors for creating a webinar like this. I myself suffered from debilitating clinical depression and excruciating anxiety and panic attacks as a young adult, from the ages of, we'll say, 18 to 20. Well, I was medicated from 18 to about 26 years old, right? And I went through the conventional system of my primary care doctor prescribed an antidepressant. I was working with a behavioral cognitive therapist, which was very beneficial in helping me understand what I was experiencing and why. The first time you experience panic attacks, you don't understand what's happening. And so that was very useful, educating me a lot on what I was experiencing, why I was experiencing those feelings. But fell short in that never did anything to address the underlying physiological contributors to my psychological condition of depression and anxiety. And I could not find a doctor who could help me to teach me what I'm attempting to teach you in this webinar. And from there, I got referred to psychiatry. The psychiatrist was managing my meds, put me on Xanax, which is an anti-anxiety medication. And once I was stable and feeling good, my request to the psychiatrist was always, okay, what is our exit strategy? I'm stable, I'm feeling good. What is our strategy to get off these medications? And the psychiatrist would repeatedly just brush it off and say, relax, don't worry about it. Come back in 6 months, we'll refill your prescription, right? And 6 months later, I'd come back, I'd bring up the topic again. And, oh, relax, don't worry about it. I will come back in 6 months, we'll refill your prescription. And that's all it was from the age 20 to 26 for all those years. And I ended up having to do a lot of self-experimentation and self-discovery to find out how I could manage my mood disorder without the medication, and then slowly wean myself off the medication. I don't recommend anybody do that without guidance, obviously, but I'm going to talk to you about a lot of the lifestyle and nutritional strategies you can implement to improve your mental health status, right? So let's run through a couple numbers here. So if we look at the amount of antidepressant use in the world, the United States leads the world in consumption of antidepressant medications, right? And you can see there, that's from the CDC website. Here we have a research paper showing how mood disorders, particularly major depression, have been estimated to be the 4th major cause of disability worldwide and continues to increase. I'll show you some numbers here shortly on how this issue is progressively getting worse with time. All right, so rates of mental health conditions in the US. So I found data from 2016 all the way to 2021. I wanted more recent data from 2022, 2023, because one of my biggest arguments against pandemic lockdowns and social isolation was that it was going to destroy mental health for young people, well, for all people, but especially young people across the globe. And so I really wanted to compare rates and how they changed from prior to the pandemic to 2022 and 2023, but that data is not yet available. So if we look at numbers from 2016, 44.7 to 46.6, 2019, 51.5 million, and then in 2021, 57.8 million. So you can see how it's incrementally increasing with the years. 2021 is estimated about 1 in 5 adults suffers from a mood disorder. And this is coming from the National Institute of Mental Health website, right? Now in kids, I really wanted to compare the rates in kids, especially when kids were kept out of school for so long. For many, especially high school aged kids, school becomes their primary social interaction with the world. And not having that can have very detrimental effects on social development. And so I wanted to look at numbers there, but there's even less data available on kids. The only thing I could find was from 2016 that 17% of children aged 6 to 17 suffer from a mood disorder. I would predict now that number is much, much higher. I'll have to wait another year before that data becomes available. But we can see here, if we focus on this paper here first, right? And I should be able to, I don't think anybody else is going to join, so I should be able to view the slideshow now for you guys. All right, so if we look at a couple of research papers here, this was a summary on that states currently there is no reliable evidence that long-term antidepressant treatment is beneficial, and there are legitimate concerns that it may be largely ineffective or even harmful in a substantial portion of users. All right, so that goes back to the idea that my psychiatrist never had an exit strategy for me. Yes, the medications helped, but how could I heal to the point of not needing that medication anymore? And now a lot of the research, the latest research is showing that a lot of antidepressants and anxiety meds are not meant to be taken long-term. They're meant to be taken short-term, and then you apply nutritional and lifestyle strategies to improve mental health. And that should be the strategy, but it is not the conventional treatment, okay? And then here we have placebo, another study showing placebo-induced endogenous opioid release. Let me move this over a little bit for you guys so you can see this. All right. Showing that placebo was actually more effective than medication in many clinical trials testing and treating depression versus antidepressant medication. And so basically what that means is you have a set of patients you treat, a set of patients you give a placebo to, like a sugar pill, and that placebo group had the same, if not better, results and improvement just because they thought they were being treated for their anxiety, right? Which is pretty ironic because the field I work in all the time, we get other professionals talking about how placebo is the main reason patients get better. But according to this latest research, the entire field of psychiatry is based around placebo and the effectiveness of placebo, right? So here's another paper for you. In an earlier study through the FDA, reviewing multiple research articles, we found that many negative trials had been misreported in the published literature as having positive outcomes or had simply not been published. So what this research paper is saying is basically the FDA reviewed a series of research papers testing antidepressant use and its effectiveness. And what they found was that the majority of researchers that published those papers either misrepresented the data, showing that the antidepressant was beneficial when it really wasn't, or they just refused to include data to make their research look better than it really was. And this ends up being the majority of antidepressant research that exists. And so we have a very effective treatment for depression. Would anybody venture a guess as to what that is? And this time and time again, research has shown that this tool has been the most effective at improving depression symptoms, even compared to medication, right? And that is exercise. So in research studies, if you compare two groups and you treat one with medication and treat one with exercise, the group that gets treated with consistent exercise consistently outperforms the group treated with medication, okay? Every single time. Now, let's look at some of the common reported side effects of long-term antidepressant use. Number one, the biggest one being sexual problems, either loss of libido, loss of sex drive, or loss of the ability to have an orgasm. That's directly linked to antidepressant medication. Weight gain, reduced positive feelings. So that begs the question, do antidepressant medications decrease negative bad feelings as well as positive feelings, so they make you more numb? Or are they really working at trying to improve or working at trying to decrease negative feelings, right? It would seem like it just numbs most people. And then, of course, the longer you're on it, you start to become dependent on it, whether it's actually doing its job and working or not. When you're on the medication long enough, you become dependent on it and feel like you can't function without it. So that's another negative side effect of long-term use. And then we have feeling emotionally numb, right? So that goes back to the reduced positive feelings. So what are some other common contributors, other common physiological contributors to anxiety and depression, right? When I say physiological, I'm differentiating that from psychological causes. When we talk about psychological causes, we're talking about maybe a death in the family, ending a relationship, trauma, psychological trauma, physical trauma. We're talking about PTSD, right? Those are largely psychological in nature. These are physiological in nature, right? So we're going to talk about all these in green here. So the number one being solitude, social isolation. Number one predictor of increasing anxiety and depression. So this is what I was hinting at when I said the pandemic and social isolation and quarantine and all this was going to have hugely negative impacts on mental health, especially for young people. The research shows social isolation permanently changes the brain. And you can see here in red, causing irreversible consequences to brain chemistry. Here we have another paper, different susceptibility of prefrontal cortex and hippocampus to oxidative stress following chronic social isolation stress. So again, social isolation, chronic social isolation causes stress to the degree that it causes inflammatory oxidative changes to the brain, right? That's why in the prison system, the worst punishment you can give an inmate is social isolation, putting them in the box, or isolating him from everyone and everything. That is the worst punishment they give someone. Okay. Now, what are some of the other causes? Well, this was an interesting article, came out, I believe, last month from the U.S. Surgeon General on an advisory about effects of social media use on mental health, especially in young people. So not only is it social media and the negative social aspects like social bullying or body shaming, whatever it may be on social media, it is also the how can I put this? It is also the immediate gratification that the brain gets accustomed to experiencing from being able to swipe right, swipe left. And it is the constant bombardment of new and novel images that increases dopamine in the brain, right? And so that creates an addictive behavior pattern. When that social media or technology gets removed, the brain becomes now depleted after being on such a high of dopamine, becomes depleted of dopamine, and you can experience mood changes like depression, low mood, anxiety, or even withdrawal from that technology. Okay. And it was interesting because this is new research coming out, and the U.S. Surgeon General is already commenting on it. And so this is another article I found in Medical News Today talking about dopamine detoxing and how dopamine detoxing is becoming a new fad that a lot of neuroscientists and biohackers are talking about. And it revolves around pretty much taking a weekend or a few days and cutting yourself off from Netflix, from your phone, from social media, because all these reinforce these immediate gratification behaviors, right? And so obviously the article ends by saying there's no specific evidence to support this method, but that's because it's brand new. Additional information will continue to come out. I guarantee it. Neuroscientists like Andrew Huberman, who I follow his podcast, can be a great resource for you. He is a PhD neuroscientist out of Stanford. And a lot of what he talks about is optimizing neurochemistry and neurology. And he's got lots of research that he's working on. And also he reviews on his podcast around improving. So you can see the title of this one was Leveraging Dopamine to Overcome Procrastination and Optimizing Effort. Dopamine is the main brain chemical that controls drive and motivation in humans. When you get a massive dopamine dump, right, you no longer have drive and motivation. You can't complete tasks. You can imagine you become almost like an ADD brain that can't focus and finish tasks on time, right? So this is a great resource for you all if you want to learn more on this. Now, what about the link around violent crime and homicide since COVID? Like I mentioned, one of my big predictors and concerns with the COVID lockdowns and the pandemic was mental health. I 100% believed mental health was going to suffer across the board, especially in young people. And so I wanted to investigate into, well, crime seems to be going up, violent crime, mass shootings seem to be increasing lately in the last year or two. What does the data show? Well, unfortunately, the data is not out yet. We only have data up to 2020. We'll have to wait another year or two, but you can see how trends were starting to climb up around 2019, 2020. 2020 here, we had a big spike in homicides. And if we look at mass shootings since 1982 to April of 2023, you can see we had a pretty big spike in 2018, 2017, 18, massive crash down during lockdowns, 2019, 2020. And then the country started to open up again end of 2021 into 2022, right? And you would think that the world would be happy to be, out and social again and not have so many restrictions. But in 2022, we had a massive spike in mass shootings to the all-time high we had back in 2018. And so 2023 is not done yet, but I would not be surprised if this number breaks the record for this year, based on how this year is going so far. So that begs the question, can mental health and antidepressant medications be contributing to this? And so there's a researcher out of Harvard who actually has been researching this for some time. And his belief, and he's a psychiatrist, I did some research on him. His name is Peter Breggin. He's about 87 years old. So he's been in the psychiatry field for a very long time. And again, he's out of Harvard. And so he spends a lot of his time just doing research and writing books and articles. And he strongly believes, and you can imagine, if he's 87, he's been in the psychiatry world since the beginning of antidepressants were even used in psychiatry. I was reading a little bit more about him, and he was still around when lobotomies were treatment in psychiatric conditions. So he's been around for the beginning of the introduction of a lot of these medication and has tracked the trends over time. And he strongly believes and has written quite a bit of research articles around the link between antidepressant use and the increase in violence and violent crime and mass shootings. All right. And these are a series of books that he's written. He's also very against ADD medications, ADHD medications, Ritalin, and just the avid use of antidepressant, anti-anxiety medications. Right. So let's move on. What are other contributors? Let's talk about traumatic brain injuries and vascular injuries. So in my last webinar around brain fog, I spoke a lot about neuroinflammation, spoke a lot about cerebral perfusion and blood flow to the brain, so lack of circulation into the brain. This can be triggered from low blood pressure, from anemia. It can be triggered from strokes, mini strokes as well. And so I'm not going to spend too much time on this. You can refer back to the brain fog webinar, which is on YouTube, because I went into a lot greater detail on these topics. But having healthy blood pressure is very, very important, right? So if you have too high blood pressure as well as too low blood pressure, that's going to influence how well you get oxygen and blood into the brain. Lack of perfusion of blood into the brain leads to negative side effects, from brain fog, from fatigue, from confusion, to poor focus and concentration, right? All over the map. So we spoke about measuring pulse oximeters, managing your blood pressure, so on and so forth. We spoke about sleep apnea as well and how you can measure that, right? So again, refer to the brain fog webinar. And there's another number of supplements, natural over-the-counter supplements that can be used to improve circulation and blood flow, right? Let's move on here. So this study showing that a 26-week trial of antidepressant treatment did improve symptoms in this study, but what they also measured before and after was inflammatory markers. And what they noticed is the antidepressants, to some degree, are anti-inflammatory. And so this research paper was stating that the potential benefits of antidepressants are not that the antidepressant works well, but that it's actually decreasing inflammation. And that decreasing inflammation is what's causing the improvement in depressive symptoms. And so we can talk all day. I can have a whole separate webinar on how inflammation comes from processed foods and high sugar foods, and basically the standard American diet and how it contributes to inflammation. This is one of the primary ways we work with thyroid patients in Hashimoto's, because Hashimoto's is largely an inflammatory condition. By changing diet, removing inflammatory foods, we can improve inflammation. All right, and our next common contributing issue is neurological autoimmune disease, right? And so neurological autoimmune disease, things like multiple sclerosis, demyelination disorder, and cerebellar autoimmunity. And so these are complex terms basically to describe autoimmunity that affects your nervous system, the brain and the nerves. Okay. Now, this is becoming a lot more common since COVID. COVID infection, as well as the COVID vaccine, has been shown to trigger autoimmunity. It's specifically autoimmunity to neurological tissue. And so this is becoming a lot more common. And so everyone who comes in to see me who has long haulers or suspected long COVID, we always screen them for neurological autoimmunity. And so I'm going to show you, we use a lab called Cyrex Labs. I'll show you an example of what their labs looks like. But this is one of the few labs, state-of-the-art labs, that actually tests for these autoimmune markers. So you can see here, this is a lab that I ran on a patient who came in who was suffering from really, really debilitating anxiety. And as a result of the anxiety, she was starting to develop depression. And it was getting to the point where driving would trigger anxiety for her, leaving her home would trigger anxiety for her. And the main variable that she pointed out to me in her history that motivated me to order this was that she had also had, over the last many years, had a series of severe vertigo attacks that lasted for hours and hours and hours, right? Now, vertigo like that is not common and not normal. And so it sounded to me like there was a potential neurological issue being driven by autoimmunity. And so I recommended we run these tests to find out if this was contributing to her anxiety. And sure enough, she tested positive for multiple neurological tissues. And so this is a perfect example. And this individual, she was in her early 30s, so she was young. She had already been on antidepressants, which she had taken herself off of because they weren't helping at all. So she was very frustrated. And this was a perfect example of an individual whose anxiety was being driven by an autoimmune inflammatory condition affecting her nervous system. And as a side effect, she was unable to manage all the sensory inputs that were coming into her brain, and it was triggering high anxiety for her. So we had to address this in a completely different manner. We had to, again, address inflammation, support her nervous system, support barrier systems, and put her on a lot of natural plant-based anti-inflammatories, and really get better control of her diet to not support inflammation. And she was pretty surprised that in about a month, she was starting to see improvements. This is by no means a short-term fix. This is usually 6 months to a year of working on this before these improve. So it's not easy. It does require a lot of work. But that was a perfect example. Now, the last common contributor is neurochemical imbalances. Now, I purposely put this last because the majority of psychiatric conditions, right, are treated as if they're all neurochemical imbalances, right? If you're depressed, they give you an antidepressant, which increases serotonin in the brain. If you have anxiety, you're given an anti-anxiety medication, which increases GABA in the brain. to help calm the nervous system down. And so this whole theory is based around, oh, you have a chemical deficiency in the brain, so we're going to synthetically give you more of that chemical to fix the mood disorder, right? But like I mentioned, that's not panning out to work so well. If you look at other neurochemical imbalances, right, neurotransmitters, which is your serotonin, your dopamine, your GABA, is one potential imbalance, but a lot of the research is showing that placebo is more effective than the antidepressants, and exercise is more effective than the antidepressants. So does this theory really pan out? It's not looking that way based on the research. Dysglycemia, so having chronic high blood sugar and insulin, or chronic low blood sugar, can cause chemical imbalances in the brain. Irritability, short-tempered, depression, especially anxiety. Hormone imbalances, right? We spoke about the premenstrual disorder, right? Leading up to a period or your cycle, and how estrogen and progesterone change from the first half of your cycle to the last half of your cycle. If there's an imbalance between estrogen and progesterone, that will trigger massive mood disorders and depression. The thyroid, we already spoke about how the thyroid can influence mood disorders, hypothyroidism, Hashimoto's, and hyperthyroidism. And then brain-gut axis dysfunction, right? So that brain to your gut connection, just like in IBS, right? Who would have thought that IBS, right, a diarrhea issue of your stomach, could trigger chronic anxiety for you, right? But I've seen it multiple times now. And sure, you can manage the anxiety, but the IBS issue is still there, and it's still going to keep driving that anxiety. So the gut is really the source of that mood disorder. And nowhere in conventional medical model, the conventional psychiatric model, is that even investigated into and addressed. That's why at the beginning of this presentation, I mentioned this work can work synergistically with that conventional model. Unfortunately, my job is now to educate those providers and behavioral cognitive therapists on how I can aid and help them. And this is especially true for individuals who just don't respond to antidepressants and anti-anxiety medications, right? There's a number of people that just don't respond. They're called non-responders. And what do you do with those, right? Chances are there's another underlying physiological contributor to their mood disorder, right? So what can you do to improve mental health, right? This is a general overview. But number one, physical exercise and cognitive activity. I spoke a lot in my brain fog course about ways to optimize the brain, learning new tasks, learning new activities, new skills, partnering that with physical skills, things like learning a dance, taking a dance class, learning a martial art, right? Those all improve brain function across the board, from improving neurochemical imbalance. You get that endorphin release, you improve blood flow into the brain with exercise. You stimulate, the memory centers of the brain that help improve mood, right? So that's the easiest thing you can implement right off the bat. The second being sleep and your circadian rhythms. Sleep, something I discovered in my journey of health as a patient with anxiety, depression, is I discovered sleep was very, very important. And it had to be consistent sleep at consistent hours. The brain heals at night. There's a concept called autophagy, which means that at night when you're sleeping, the immune system in the brain activates and clears out metabolic debris. It clears out garbage that has accumulated through the day. If you have terrible sleep habits or you don't sleep, your brain cannot heal through the night. This is very, very important. If you have disrupted circadian rhythms, meaning you're sleeping in the day and then you're up all night, that is terrible, terrible for the brain and improving neurology. You have to try to work at improving that circadian rhythm. One of the strategies I often educate patients on is go camping. I think camping can be hugely beneficial because if you go somewhere where there's no service, no electricity, right? You disconnect from technology. You have to rely on sunlight to wake up. When the sun goes down, it's dark. Your body should go into sleep mode and start to shut down. So if you consistently do that, you can rewire your circadian rhythms to the sunlight, right? So that's very important to do. Blood glucose stability. So we talked about dysglycemia and blood sugar stability, very, very important. Our future webinar is going to elaborate a lot on blood glucose stability, but many people I find don't eat enough calories to fuel the energy they expend each day. So we go through, we have them journal what they eat, what time they eat. We optimize protein intake because protein is probably the number one important nutrient that most people do not eat enough of, especially for the immune system. Antibodies are made based on your protein intake, right? All the talk during COVID about antibodies this, antibodies that. The majority of the population underconsumes protein, and that's going to cause your immune system to be deficient in antibody production, right? Rule of thumb is you should be eating about 1 gram per pound of body weight, right? So I weigh about 155 pounds. I strive to eat about 155 grams of protein a day. And if you're not consciously working at doing it, it's very difficult to do. It took me months to actually get into a rhythm of knowing how much I had to eat of protein at each meal to be able to reach that goal by the end of the day. That's something we coach patients on and teach them and track them over time. Anti-inflammatory functions. So we're talking about sleep is anti-inflammatory, exercise is anti-inflammatory, and there's a number of natural supplements that are very anti-inflammatory. Anything from vitamin D, optimizing vitamin D levels, turmeric, omega-3 fish oils are all very anti-inflammatory and very beneficial for brain health and improving chemistry in the brain. And then microbiome health. So the gut, we've talked a lot about the gut, but if you suffer from IBS, IBD, chronic bloating, distension, chronic diarrhea, chronic constipation, any of those, right? You have a microbiome issue, and that can ultimately influence the brain, neurology, and your mood, right? One of the leading theories behind Parkinson's disease and the main cause of Parkinson's disease is an infection in the gut that travels up the nerves, affects the brain, and causes an inflammatory response in the brain, leading to Parkinson's disease, okay? A lot of early Parkinson's symptoms, and we're talking 20 to 30 years before Parkinson's disease even gets diagnosed. A lot of the earliest symptoms are in the gut. They're chronic constipation, lack of stomach growling, lack of motility through the gut, okay? So, as a quick summary, the main pillars of mental health that you can implement today are going to be sleep, having a consistent sleep schedule and getting your 6 to 8 hours. For some people, that might be 9 hours, but optimizing your sleep consistently, very, very important. Exercise 4 to 5 times per week. If you're an avid exerciser, working on high intensity interval training tends to be the most beneficial for brain health. If you are not an avid exerciser, start with walks. Go out for 30, 40-minute walks. That's a good place to start, but you have to keep ramping that up. Really, what improves blood flow and circulation into the brain is getting your heart rate up. So if you're just going on leisurely walks, but your heart rate isn't spiking, you're not getting the full benefits. Optimizing nutrition. This is what we spend a lot of time on with patients when we work on them with them one-on-one. Eating real food, cut out the processed and packaged foods, plenty of protein intake. Don't depend on coffee to function, right? There's a lot of conflicting information around coffee. Is it good? Is it bad? I always tell people this: coffee is neutral. It's not good or bad, right? Coffee does have a lot of antioxidants, which are anti-inflammatory for the brain. They're neuroprotective to the brain. But the majority of Americans depend on coffee and caffeine to function. If they don't have their coffee, they don't function. And that is not useful. That is counterintuitive to your health. We have to rebuild patients to a point where they can function without coffee. And we do that by correcting their nutrition, getting them exercising in a consistent sleep schedule. And then they can enjoy their coffee as a treat, right? They don't depend on it to function. And too many people depend on coffee and caffeine to function, right? And then the last one, that's brand new information, brand new research that's coming out, partially by Dr. Andrew Huberman, the resource I shared with you, but the use of hot saunas and cold plunges is showing to have huge impacts on chemistry in the brain. I've always loved sauna. I've hated the cold, but I've started myself experimenting with cold plunges and cognitive effects because, something psychiatrists will always tell you is anxiety, depression is never cured. You just learn to live with it. Well, I would challenge that and say, I've beat it. I've been able to get off medications and maintain. The depression's virtually gone. The anxiety is about 98% controlled. And I do it using these specific tools right here: consistent sleep, consistent exercise, and always optimizing my nutrition. But there's always improvements that can be made. And cold plunges is something I'm starting to experiment with myself, because the cognitive benefits that are being reported as far as the improvements in dopamine. So the way it's being used is first thing in the morning, before you start your day, cold plunge. 30 seconds to a minute, around 50 degrees or below of water temperature. And you get such a dopamine increase naturally, not the same dopamine spike you get with technology and social media, but you get such a healthy dopamine increase that it drives motivation and productivity that rest of that day. And so this is brand new information in this area. I recommend you start to read up about it, do your own research on it. I think it's going to show to be hugely beneficial for many people suffering from mood disorders. All right, so I'll skip over these last couple slides. Future webinars, right? Like I mentioned, this is holistic approach to mental health. Our next one, I believe, is on thyroid. 3 thyroid health secrets keeping you sick, right? And let me take a step back and say, if you have a thyroid condition, right, you would think, okay, well, you go to an endocrinologist. The endocrinologist manages the thyroid condition. The thyroid is probably the largest mismanaged system in conventional healthcare. My whole practice is built around helping people with thyroid conditions because it is so mismanaged. We're going to talk a lot about, there's a lot you need to know about it. So that's all I'll say about that. Tune into our next webinar for that. Female hormone health, we have a future webinar on that. Gut health, and then blood sugar and insulin resistance, right? So that's every second Tuesday of the month, up until November. November will be our last one, right? And perfect. So we always offer a free 30-minute consultation for any new patient who wants to consider working with us. We have to check, we go through a quick history, we see if you qualify for care, and then we go from there. Let me see if there's any questions. All right, we do have some questions. Awesome. So let's see. So we got a question. Antidepressants tend to cause constipation. Serotonin is produced in the colon, which slows serotonin uptake. Exercise causes the colon to move and stay more clean. So more certain. Oh yeah. So okay, more of a comment than anything. Yes, yeah. So exercise is a useful tool for constipation, and that's through that brain-gut axis connection, right? Exercise activates the brain. You can activate the brain, which sends input through the nerves out to the gut, and you can improve motility and calm gut issues through exercise. They say all disease starts in the colon. A majority of them do, yes. All right, perfect. No other questions, no other comments, it looks like. Thank you all for joining me. I apologize for the technical difficulties. I will provide you all a recording of the webinar. I'll send that out in an email, hopefully by tomorrow morning, so you can review a lot of the information we spoke about. Stay tuned for our next webinar coming up next month, second Tuesday of the month.